Hi, this is Stephanie Patton, your prevention coordinator, and we are at the last of our short videos about the results from the 2026 Youth Health Survey at Stoughton High and OMS. And so today we're going to run through a couple of the other behaviors that we try to capture on this survey. This video series, of course, didn't include every single question that we asked students. It really is just intended to be a highlight. If you are more curious about some of these data points, please reach out. My contact information is in the last slide. So here we go. Let's look at screen time first. And so screen time hasn't changed significantly for students in terms of self-reporting since 2024. We are seeing a fair amount of students, both at the middle school and high school, who are reporting 5 or more hours of screen time on school days. We did ask students to think about screen time that was not related to schoolwork, that was not like listening to music, that really was engaging in other screen activities, gaming, social media, watching movies, those types of things. We do know at the high school that when students reported 5 or more hours of screen time, it did also increase the likelihood of them reporting depression or frequent anxiety. There's there's no way for us to say whether that's causal or not. We just were able to see a relationship. So, how those things interact together is interesting, important. The library at our recent youth health fair asked students about screen time, and middle school and high school students, actually, a lot of them, when they looked at their phones and they actually looked at their recorded screen time, were reporting 6 or more hours. So important finding to think about here. As we have conversations with our kids about screens and thinking about what that means in the course of their day. We also look at physical activity. We know that most of our students, actually, both at the middle school and high school, are reporting that they're being physically active for 3 or more days in the past week. And so that question was really about being involved in something that made you sweat or breathe hard for a significant period of time. So actually, what does it look like to really be moving our bodies? This number is down a little bit from 24. Not a lot, but a little bit. Something we again want to be paying attention to. We know all the benefits of physical activity when it comes to physical and mental health. And so, important piece of information that we gather as well. We also looked at sleep and we asked students about their average number of hours of sleep on school nights. Again, this data looked fairly similar to the data we collected in 2024. That green bar, the 8 to 10 plus hours of sleep, really is where we would love for students to be getting as much of the recommended amount of sleep as possible. We do see the red bar all the way on my right, the 6 or less hours of sleep increasing as students get older. Not surprising given the amount of students that are involved in extracurricular activities and have other commitments, especially as they get older. And still something we want to be paying attention to, making sure our young people are getting enough hours of sleep. We do know that students who reported 7 or more hours of sleep, I apologize, who reported 6 or more hours of sleep or fewer, 6 or few hours of sleep. It also 32% of them reported some level of depression. So there's some connection potentially there. You know, there are lots of relationships between sleep and mental health. And so again, it's something we want to be paying attention to. And so that is the whirlwind tour of all of our data. Again, my name is Stephanie Patton. You can find me at the prevention department, which is located in the recreation building at 15 Pleasant. You can absolutely reach out to me by email. You can find us on the web at www.stoughtonoasis.com Org or on social media at Stoughton Oasis. I would love to connect and answer questions for folks if you're curious about the data. This is a really important initiative that we do in collaboration with the Stoughton Public Schools to really ensure that we are capturing the current needs of students and we are paying attention to trends and student needs. It absolutely is connected to the programming that both we do as a coalition and the school department does use this data to make decisions around making sure there are opportunities for students to be learning about their health. A big initiative that we do every year that actually this year just happened was the high school and middle school health fair, where a lot of these behaviors get highlighted with resources and opportunities to learn about them and to be connected if students need more help and support, which is always a really fantastic day that we get to do together with lots of our community partners. And so I look forward to hearing from you. If you have questions, please feel free to reach out. I would love to talk about data. It's one of my favorite things to do, and I hope you all have a fantastic day.